Thank you for tuning in to Doctor On Call. This is an informational program brought to you by the Spine and Neuromuscular Associates and Dr. Cobb's Healthy Pursuit Medical Center, located at 120 Industrial Drive in Lawrenceburg. This show is not meant to diagnose or substitute medical advice from your personal physician. For specific medical advice and diagnosis, please contact your personal physician.
Eagle 99.3, this is Doctor On Call live in studio, and you can learn more about Dr. Cobb and the other doctors at the Spine and Neuromuscular Associates by visiting their website, spinecentersei.com. Spine and Neuromuscular Associates of SEI PSC. There are 7 doctors under one roof. You could schedule your appointment today by calling 812-537-5616. I'm Russ Roberts. With us always is the resident expert, Dr. Cobb. And, of course, if you have any questions for Dr. Cobb, give us a call live in studio at 812-537-9724 or toll-free 888-537-WSCH. Dr. Cobb, how are you tonight?
Oh, I'm doing terrific. And as always, I want to remind our listeners that this is the program that asks the question, who is in charge of your health?
That's right.
Tonight, we are going to have a little storytelling tonight about a story that really embodies the concept of taking charge of your health. And I am joined by not one, but 2 individuals. One is one of my colleagues, Dr. Michael Delre, and the other one is the inventor of a product called The Finisher, Merrill Hutchinson.
And we're going to have fun tonight because I know in your promo, we're going to throw it all aside. None of the sex, drugs, and violence. We're throwing all that aside just for tonight.
Just for tonight.
Just one time.
And I want to start with Dr. Delre to kind of share how he came across this tool and how it is making a difference in the physical therapy department at the Spine and Neuromuscular Associates.
Yeah.
Well, thank you, Marcus. Basically, a quick summary of our story is a fellow coworker of mine and friend, Nick Story, asked me to come down and actually meet with Hutch so we could actually examine this board. He said he didn't know exactly what it was, something about sliding around. And it sounded like fun. It was a great way to spend my lunch.
There you go.
But to break it down, this board is something that we actually regularly use for the upper half of our patients. And without giving too much information away, we like to think of it as kind of a great equalizer. It's a nice way for us to balance out all the strengthening that everybody seems to enjoy doing in the gym with the real strengthening that they actually need to do. For example, in the gym, everybody always wants to do bench press, curls, crunches. That's great. That's the front part of your body. What about the back portion?
That's right.
This is what actually prevents pathology from occurring. So we've had this great device. We've had great success. We've treated neck patients, shoulder patients, back patients, everything you can think of under the sun. If it involves the upper half, we're taking care of it.
I find this intriguing, and that is why we're doing this show, because the bits that I've learned about the Finisher has taught me that this is not just something that should be in physical therapy departments, but should be in gymnasiums, and for a lot of people, they probably should have one in their home. And to kind of bring the story together here, we want to introduce Merrill Hutchinson. Now, your name is spelled Merrill, but when you first told me your name, it sounded more like Merle.
Well, it depends on what county you're from, right?
You're exactly right, Ross. It's Merrill in some counties and Merle in others.
That's it, Merrill.
Yeah,
that's
one
my buddy
of those
Merrill.
family names. Yes.
Now, what do you do around? I know you're a hometown kid and you're from this area, but what is your day job?
Okay. Well, first off, I want to thank Dr. Cobb and Dr. Delre for your interest in the Finisher and just having me on this evening. I appreciate that. My day job is I am a school counselor at Bright Elementary here in the Summit Dearborn School District, and have been doing that now. I'm in my 17th year there at that position, and prior to that, I was a high school teacher at East Central High School, taught the sciences, and also a few years over at South Dearborn, which I graduated from South Dearborn High School somewhere back in the early 80s.
Okay,
yeah.
So you are truly a hometown kid.
A few years ago.
Just a few years ago,
A few years ago.
Yeah.
Well, in your story is fascinating, and really we could spend the whole time telling your story, but we don't want to do that because we want to also give just due to the actual device, the finisher. But just take a couple of minutes to tell people how you got to the point where you needed to start working on developing this device.
Okay, sure. Well, first off, I've always been very active with running and swimming, triathlon type things, cycling. And so I'm very familiar with the whole idea of working out. Well, through just the wear and tear on the body and probably, as Dr. Delre was talking about before, probably improper use of exercising, I've managed myself into 3 neck surgeries.
Oh, gee.
Yeah, and so my last neck surgery was a pretty drastic surgery. We had a fusion between my C4 vertebrae all the way down to the C7 level. So now I've got a nice plate in there that keeps my head from falling off. That surgery, the actual neck part of that went well, but when I came out of surgery, I quickly lost strength in my left shoulder. Sure. And noticing the pain, and went for my follow-up visit and described this to Dr. Bohinski over at the Mayfield Clinic, and he was like, I have some bad news, and that is you have C5 palsy. There's 1 to 2% of the population that has this particular surgery ends up with this condition.
Oh, my.
And C5 palsy essentially means that the nerve that feeds that left shoulder and the front of the chest and the back or the scapular area basically stops working. Okay. And they don't know exactly why, but anyway, it stops working. And he said, I don't know how long this is going to take to come back. We don't even know how much it will come back. We want to get you into physical therapy as soon as possible. And let's see if we can stimulate the nerve to wake back up, to come around, and do everything we can to keep the muscles from atrophying in the meantime.
So at that point, you didn't know what your overall prognosis was going to be.
No, and I mean, I was actually a little frustrated and angry and sad just because I came out of there, trying to get the neck fixed, and now I had second guessing going on in terms of should I even had this surgery, because I can't even lift my left arm now.
Well, Merrill, let me ask you this quickly. If someone's just tuning in at Eagle 99.3, they're hearing this story, and there's one very notable athlete that's kind of dealt with something similar here recently, Peyton Manning.
Sure.
And and that's exactly because now, again, it is that rare minority, but how many surgeries did he have? And that's kind of what happened. He didn't have the, maybe it was, and Dr. Delre, I'm sure you know more exactly, but that nerve damage, he couldn't throw, and it just took a little time, and they thought it would end his career, right? I mean, something similar, right?
Yeah, I don't know exactly the details of his situation other than the neck surgeries, but, for my own situation, I came out of there feeling, like it maybe wasn't a good plan for my future. So
at that point, I know you tried to do everything you could yourself at that point. What did that consist of?
Well, I did start right off the bat into physical therapy with Phil Honing up in the Bright Physical Therapy Clinic that he has. And Phil's a very candid individual, and he just said, dude, you don't look good. And we worked for the next 4 or 5 months doing some very standard physical therapy type things. And finally, after about 5 months, I at least got range of motion back in the left arm. No strength. Couldn't really even lift a weight.
So things were moving really slowly.
Very slow. But there was some progress.
Enough to give you some hope, at least, to say, hey, we're moving in the right direction.
Yes. And, and at that point, I was seeing him a couple times a week, and I have a basement full of workout equipment. That would be kind of my little hobby that I like to partake in. And
a lot of guys have some workout equipment in the garage or in the basement.
Sure. Yeah. And so Phil Honing and I just said, I'm comfortable with working out on my own. I know what I need to do there. Mm-hmm. And I was just going to check in with him periodically. Okay. And if there was a problem, of course, more frequently. And so basically I'm back in my basement now, and I am dreaming, thinking, exploring of how can I get better? What can I do to get this shoulder moving? And, that's difficult when you can't even really pick the shoulder, pick the arm up.
Absolutely.
Can't do standard weight type things. So I literally started picking up dumbbells, moving them out onto the concrete floor with a 2-pound dumbbell, and I began sliding them back and forth.
On the floor?
On the floor,
So
scratching up the
going
concrete
against
floor.
gravity, you're just going side to side.
Sure, just sliding.
Just getting the movement.
I'm
Yes.
sure your wife appreciated the noise that made on the concrete.
Yeah, that was nice.
I never even thought of that.
Yeah,
That probably
and I
was pretty.
I was spraying some WD-40 and stuff on the ground to make it a little less.
Yeah, that's fun.
But it was very interesting because I was actually able to do lots of different types of ranges of motions in different planes with these motions. And my little sideline, I also do a lot of handyman work. I just like to work around the house and do some remodel stuff. And I've finished a little bit of concrete over my days, and I'm not very good at it, but nonetheless, I give it a shot now and then.
So finishing concrete, that's that little flat sander-looking
Trowel,
thing, and
like
you
a
just
trowel. Yeah.
Yeah,
What's
flat,
it called?
A trowel.
A trowel, and you're doing
trowel,
the
okay.
flat work concrete, driveways,
and
and
you're
stuff like that.
sliding it across
Sure.
to smooth the concrete.
Kind of like
Exactly.
Danielson, kind of the wax on,
Wax
Yeah.
on,
kind of-
wax
yeah.
off. That's right. And so that's really what started coming to my mind. It was like, this is so much like finishing concrete. So I really, at that point, started organizing.
I just want to jump in here. Finishing concrete, is that where you got the name from? Literally, the
And
finisher?
then that's exactly where we came up with the name of, I'm going to call this thing the finisher. And it just rang to me.
Hello.
And then this is now the practice or the exercise of finishing. And that's literally what we are pushing here and teaching, a new brand of exercise called finishing, unlike jazzercise or anything like that, but this is finishing, and it's essentially a very organized method of sliding and moving these particular weights that we have across a very slick surface that we have on our product.
So what you're telling me is that what started out with you desperately trying to improve the strength in your neck and shoulder, and you just doing what you could, not going against gravity, has turned into a device that potentially millions of people could benefit from.
Yeah, I mean, that's really kind of where we were after I had done this for some time. I really noticed a quick improvement in my shoulder.
Okay.
And I was getting excited about that. I'm coming up from my basement after a workout, and I'm looking at my wife going, you know what? That's a pretty good workout. That's amazing. And of course, she looks at me like I've, my head had 3 eyes on it or something, going, yeah, whatever. But with each attempt of working that arm, I was excited and more encouraged. And so working at Bright Elementary, one of my parents there, Scott Daniels, is the head of all physical therapy for Wellington Orthopedics. Mm-hmm. And I run into Scott now and then, and I said, Scott, I have this thing, and I explain my story, and I have this product or this thing that I've made, and it's basically my piece of workout equipment that I have. But I said, I'd like to show it to you.
Yeah.
Because it's really been helpful to me. And you know what? If it's a piece of junk, you can just tell me so, and I can handle that, and I'll just keep it down in my basement, and it'll be mine. But I said, if you think you could use it, I'd like you to see it. And so with that, Scott was more than willing to take a look at it, and we went through it, and I showed it to him, and frankly, he surprised me. He was very...
Sounds like you surprised him.
Well, he
sure you
said,
did.
you know
How did
what?
you know?
He said, Hutch, he said, you got something here. He said, this really opens the door for a lot of different things, a lot of different uses. And he just started kind of dreaming and picked up the weights and kind of started doing some things and
Expanding on it a little bit.
Yeah, and right away, and he was like, you know what, I want these in my clinic.
Doc,
and he
wow.
said, you need to start developing this. And so with that, we've spent the last 4.5 months trying to bring it to the market.
Okay.
You want to say it, or you want me to say it?
Go ahead.
Necessity is the mother of all invention. I mean, if it's not ever applicable anywhere, it's applicable in this story right here. That's what it sounds. I mean, that is exactly what it was. It started from something that you just had to do something. You were in you started training. It just wasn't enough. It wasn't working. You couldn't do a lot, but you identified you had to do something.
Sure.
And that's kind of where it all started. I got to do something more than what I'm doing. What I'm doing is not working. Then you found something and kind of, you kind of mixed it up a little bit, right?
I'm going to ask Dr. Delre to kind of give a description of his opinion of what makes this thing work. But before we do that, let's give the actual website. And that is finishingfitness.com.
That's right.
So the word finishing with no space, then fitness.com.
All together, finishingfitness.com.
All right, Russ, why don't you give our contact information here tonight, and then we'll have Dr. Delre wade in a little bit.
Absolutely. I just want to remind everyone, this is Doctor On Call on Eagle 99.3. You can call the studio now at 537-9724 or toll-free 888-537-WSCH. Any questions that you have, well, I'm sure we can tackle those. And you can learn more about Dr. Cobb and Dr. Delre, the other doctors at the Spine and Neuromuscular Associates, by visiting their website. It's SpineCenterSEI.com. Spine and Neuromuscular Associates of SEI PSC. 7 doctors under one roof. You could schedule your appointment today by calling them at 812-537-5616. And, of course, we always welcome you to participate. And, of course, if you have a question you don't want to call in, you can also post it on our Facebook page, which is Eagle 99.3 on Facebook.
Yeah. Now, there's a lot of different questions that I have in terms of, what it does, who should be using it, how should they use it. Dr. Delre, bring your expertise to the table as far as someone who has used this device yourself and has implemented it for patients with various situations. Who should use this? How should they use it? And what should be expected?
Yeah.
I would say that the most important use of this is for anybody with upper half problems. Anything going from the waistline up, they're going to actually improve from it. If you're taking a neck patient, the great thing about the board is you can actually adjust the height. You can lay it on the floor or you can have it up higher. When it's higher, it actually acts as a good core controller for neck patients.
Wait. Core controller. Explain what that means.
Explain core,
And when we're thinking of your core, everybody that wants to work their core, they think crunches.
For abdomen.
They think abdominal crunches.
Six-pack, got to have the six-pack.
Got to go forward, back, repeat 1,000 times every day and you're good. The reality is for proper core control, you need to have some abdominal function. You need to have some oblique. That's going to be your rotation. You definitely need to have some extension. Most people cannot actually extend backwards, especially if they have a neck problem. They lean further and further forward. It's not just a problem that you might find somebody that pushes the shopping cart around Kroger that actually looks like they're about to fall over. No, that's not the person with a forward-leaning posture. That's the person that's in front of a computer, the person that's driving for long periods of time. When you straighten up and a person looks over and they see that your ear is 2 to 3 inches in front of your shoulders, that's you. That's the problem with your neck.
That's extremely common. I mean, there's a lot of folks that spend most of their day at a computer.
That's right, and it's one of those problems that we've developed for ourselves. It's a modern-day problem. When we were out hunting and gathering, we didn't have to worry about forward posture. Right. Now we have to worry about it. We're leaning further forward. We're tightening up the musculature on the upper half of our shoulder blades. We're weakening the musculature on the lower half of our shoulder blades. The great thing about the finisher is you don't pick the weight up. By limiting your ability to lift the weight up, you can't activate properly the front portion of your body. So you're not going to be activating your biceps as sufficiently. You're not going to be activating your pecs as sufficiently. They're going to be active, but you're actually going to be activating what's on the back half of your body. And more importantly, you're going to be activating what's on the lower part of your shoulder blade. It's going to strengthen, and it's going to pull your shoulder blades down. It pulls your shoulder blades down, it pulls your head back. You squeeze your shoulder blades together right now, your head probably drops back a little bit. You let your head go forward, you feel your shoulder blades round forward. This is what the finisher changes for a neck patient. If you want to talk rotator cuff tears, lots of them. See them every week. They just keep rolling in. I wouldn't have anybody stop golfing in the world because that's good for business.
But but here's the thing. You know what? You've said that, and you touched on this a few minutes ago. You said the average guy, I'd kind of fall into that. You go to the gym, what are you doing? You're doing bench press and guns. Got to work on the chest and the buys. Nobody wants to do other exercises that make you balanced out, and this is one of those things. Everybody wants, I got that big chest and I got these arms, but it's not. It's that posture. Back to what we were just talking about, and that's not sufficient. When we were hunter-gathering, we were using all of our muscles, right?
All right. Nobody talks about how much they can do for lat pull downs or rows.
That's right.
They don't want to know how many back extensions they can do. They don't want to know how long they can hold a plank. They want to know how much you bench.
That's it.
And the great thing about the finisher is if getting back to like a rotator cuff repair, is it allows you to slide that weight in multiple planes of motion like Hutch was talking about. We're designed to have all of our joints function, and you don't need to know these, but function in 3 different planes of motion. It means every time we make a movement, we're moving in 3 different directions. No matter how small, and whether you realize it or not, it's happening. And what the finisher does is it allows the freedom for somebody to go in different directions and hit all those target points without having you lift the weight. Most rotator cuff tears, you end up having to work about some type of rotation. You have to actually pivot your elbow, and your hand actually has to come back and around. So you're actually trying to strengthen something along those lines. The great thing about the finisher is it lets you initiate that. If you just had a fresh rotator cuff repair, you're not lifting the weight, you can actually move it around.
It sounds like there's a large portion of people that would benefit from using this device.
There are a lot of people. We actually we received a whiplash patient, a younger gentleman, 21, 22, ripped. I mean, you would think this guy is the epitome of fitness.
When you say ripped, you mean his muscles? So he had a lot of definition and
low body fat, in shape,
and all
everything.
That.
Yeah,
Okay.
he looked like he could just pick me up and toss me out the window. You know, I say the wrong thing, I'm gone through the day. So, needless to say, I politely said, "Excuse me, sir, but it appears that you have a few deficits." And like what? You know,
what are you talking about?
Yeah, I'm perfect in every way. No, what we ended up doing was we put the finisher on the floor, changed the levels. Originally I talked about having it up high. We dropped it on the floor. That actually forces the body to stabilize through the scapular complex, the shoulder blade complex. And if you want to talk about taking a hulk of a man and making him into a sweaty mess that had to repeatedly take breaks and ask for his mommy, that's what we got.
But and I'm glad you said that, because historically that's the type of exercises, and you said that it uses several muscles at one time. As an old meathead, I mean, I'm a weight guy for years. You're so concentrated on using one movement at a time, and this movement here, it's multiple muscle groups at the same time, which, if I'm imagining in a rehabilitation situation, you don't have to do as much, because you get that targeted group very quickly, and I can imagine it would fatigue you very quickly as well, right?
Yeah, it's a great workout. It's something that I've used. I've used it up high. I've used it down low. I've appreciated the different movements. Like I said, with this very strong individual, we worked him over fast. It doesn't have to. Now, we use 50-pound dumbbells. We didn't exactly have him sliding around lighter weights, but it wore him down quickly. We have 80-year-olds that are using 25-pound dumbbells. We have the height raised. It just depends on friction more than anything else, and they move it around very well. The one feedback that we've had is they're working an area they didn't know existed.
Yeah.
Wow.
And that's the great thing. When you look at the modern fitness fanatic, you tend to see a balled up musculature or definition in the front half, and you tend to see very little definition in the back half. And in fact, you actually see that the shoulder blades are wider set than a person that doesn't work out. And that would say the advantage is actually to the person that doesn't work out, because they're more properly balanced. Why would I want to change that? I don't know. Maybe because I want to be out of business. But I mean, for me, it's great business to have people just continue to keep working out the way they are. What Hutch is actually offering is an alternative to balance you out, and means less quality time with me.
Wow. Now, Hutch, now that's what people call you, right? Your real name is Merrill Hutchinson, but you go by Hutch.
Yeah, that takes care of the Merrill problem.
Okay.
Well,
there you go.
So the question then is, who should be using the finisher?
Well, you know, that's a great question, because one of the things to kind of run off of what Dr. Delre was talking about, the exercise here is really, in your field, is kind of termed as functional movement, functional exercise. And it is about function in everyday life, okay? So that opens up the door for everyone. Wow. All right? And it is not specific to anyone. meaning, just football players or just tennis players. There is something for everyone on the finisher and using it, depending on what your goal is, just because of what Dr. Delre was talking about, the great equalizer. It's going to balance you out and make you a better all-around athlete, if that is your desire, or to just be better fit. My neck problems, 3 neck surgeries, folks, in large part, I've had 2 doctors tell me this, it is from improper posture and training over the years, what doctors refer to as being pec heavy or overly strong in the chest and rounding those shoulders out. And then I do have a job where I sit a lot and look down at a computer. That's like taking a rope or a cord and just wrapping it around. It's
pulling you down.
Yeah. And so anyone can use the finisher here and benefit.
So somebody that has had an injury or has had need of surgery, they can benefit from using the finisher because it's going to help them rehab.
Right.
But you're saying that even people who don't have any particular injuries
staying in shape
can use the finisher to help balance their musculature and also improve their posture and reduce their chances of injuries and the need for rehab.
That's correct. And, the neat thing that we've kind of stumbled on, there are several things that you sort of discover as you do this. And the core strengthening was big, but the aerobic strengthening and conditioning that came from this, because we run a timer on this, so it kind of becomes a very concentrated interval training or, you've seen with CrossFit and types of things like that.
Short
where
bursts.
You're going to these bursts. So we're changing it up, and we do our rounds that are basically about 10-minute rounds, and we do 3 or so rounds of that. Well, when you finish with a half hour of working on the finisher, you're looking at a pile of sweat.
Yeah. Wow.
And your heart rate's been up to 125 to 140 beats a minute, depending on how hard you want to work it. And, that's that aerobic part also.
So somebody would have to work up to that. In the beginning,
sure.
I mean, somebody who's not in good shape, can they still use the finisher and to advantage?
Yes, definitely. The one thing, there's cautions with everything, and we first and foremost say let your body be your guide. If you'll have to work at the level that your body is going to allow you to work, whether it's the intensity or whether it's the ranges of motion that you're doing. Not everybody's shoulder joint has the exact same flexibility and range of motion. So that's something that we have to work.
But the good thing about this, what I'm hearing, is that anybody virtually and everybody that is above ground can use and benefit from using the finisher.
Yes, I would say so. And at first, it's going to take the average person 3 or 4 attempts at it to kind of learn the style of exercise. Because it is something new and different. So like learning any sport, you feel a little uncoordinated at first. But after 3 or 4 tries of this, all of a sudden you start to you feel the smoothness and the fluid motion, and it actually becomes very rhythmic. And next thing you know, you've got the music on or watching TV or whatever you're doing, and you really can fly through
Dr.
this.
Cobb, Dr. Delre, this is not, if people are just tuning in, this is not something we're on here. This is not some infomercial where Dr. Delre decided to say, hey, I validate this product, I'm going to endorse it. This is not one of those situations, because a lot of people might, think, well, we're hearing a lot about this. This is not some endorsement that's, that we're just talking about this product that somebody's trying to market. This is something that you guys are using. This is something that is changing people's lives, right?
That's right. I use a Total Gym. I don't need to validate that. Chuck Norris already did it. Yeah. But the finisher does a great job for the upper half. Right. It's something that I use. It's something that I appreciate. It's something that I would encourage more people to use. And that's why the whole reason why we're here. One of the great things is that if you go to finishingfitness.com, you'll actually find that he has mats that you can actually use at home. So when you're, in ground, or not above ground, I guess above ground. Hopefully hiding from the snow that'll be coming this year.
That's right.
When you're inside, make sure that you get on one of these finisher boards, get your strength up so that when you actually go outside and start gardening, you're not going to see me 2 months later.
That's right.
If you want to avoid seeing me, this is a great way to do it.
Right.
That's the best recommendation I can give. If you want me to go out of business, you go buy a finisher.
That was not the purpose of this at all.
Yeah,
It's a great product. If I could avoid people having to see me and going through pain, I'll do it in a heartbeat. So I couldn't recommend this more for that purpose.
So the finisher belongs in physical therapy departments. Sounds like it belongs in workout gyms. And from what I'm understanding, a lot of private homes should have a finisher in them, and that anybody could use.
Yes. Yeah.
If you can buy products like P90X and Insanity, you can definitely get into the flow of the finisher. It'll help you out a lot.
Wow. Well, gentlemen, thank you for joining us.
Absolutely.
And that is Dr. Michael Delre, our Doctor of Physical Therapy and head of the department at Spine and Neuromuscular Associates, and Hutch, otherwise known as Merrill Hutchinson. Thank you for coming in and sharing about this.
Thank
and
you.
it is finishingfitness.com. Next week, we're going to be talking about Thanksgiving and being thankful, making you healthy. And I'm going to have a guest, Dr. Silverman, talking about heart math.
Thank you for tuning in to Doctor On Call. This is an informational program brought to you by the Spine and Neuromuscular Associates and Dr. Cobb's Healthy Pursuit Medical Center, located at 120 Industrial Drive in Lawrenceburg. This show is not meant to diagnose or substitute medical advice from your personal physician. For specific medical advice and diagnosis, please contact your personal physician.